Health Cabinet Secretary Cleopa Mailu swept into Kenyatta National Hospital unannounced, hoping to get an unvarnished view of hospital operations. He and his team headed right to the theatres to find medics in the middle of surgical procedures, and as the surgeons worked, the team from the ministry assessed the equipment in use at the country's largest referral hospital and the people wielding them. As the group moved from the theatre to the maternity section and then to the accidents and emergency unit, members of staff had pressed to explain what was happening and why. The visit was prompted by complaints about operations at the theatre. The back looked so huge, patients requiring heart surgery, for example, could only be scheduled for 2018, a situation blamed in part on inadequate equipment and personnel.
The items they use in theatre after use must be sterilized so that they can be taken back to theatre. Their machines are broken down. They have 6 machines. At the moment, only 1 machine is working.
Officials also found that the hospital was overwhelmed by the over 2,500 patients received daily, citing as an example the case of a man who spent 60 days at the emergency unit, receiving care as he waited for admission.
Nairobi County institutions, which are supposed to operate 24 hours, are closed at 5. It means all those patients are transferred to Kenyatta. And therefore, when emergencies overwhelm the institution, then they cannot perform the routine operations. Therefore, those patients end up lying in the hospital for longer.
We are going to work on a program to decongest KNH so that we'll be able to receive those patients whom we are able to handle and also within the criteria in which this institution was set.
Mailu also raised the issue of the hospital's policy of holding patients who had not yet cleared their medical bills. The ministry now set to hold talks with the hospital's management to chart the way forward. Wilkis Anyawa, The Big Question.